Welcome to HealthTech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Bill Oldham, a transformative leader and the president of AscellaHealth with over 3 decades of experience across health technology and innovation. Bill has driven ascendant growth through entrepreneurship and collaboration. Under his leadership, AscellaHealth has emerged as a pioneering global specialty pharmacy solutions organization. From receiving awards like Philadelphia Business Journal CFO of the Year to steering his company towards 1,556% revenue increase over 4 years, Bill exemplifies innovation growth and patient-centric care. We will explore his entrepreneurial journey, AscellaHealth's impact, and the visionary insights into healthcare's future. Welcome to HealthTech Heroes, Bill.
Thank you for having me. It's great to be here.
My pleasure to host you today. Bill, with over 3 decades of leadership across health and technology, what personal experience or moments from your early career inspired you to pursue entrepreneurship and innovation in healthcare?
I think that the defining experience for me in healthcare was when I was able to join a telehealth project in the Middle East as the marketing director. And I was able to connect healthcare organizations really from all over the world to drive better patient care, better medical training, and the opportunities for improvement in quality of life for people that might not have had that opportunity if it hadn't been for the technology that we were able to deploy. So it was exciting to see telehealth, and it was exciting to learn and see maybe I can build those kinds of solutions on a broader scale for more people. And that was able to get me very excited about the potential of tech and healthcare.
That was awesome. And you said you had joined initially in Middle East. And very specifically, what took you to Middle East, and why telehealth in Middle East? Because I would imagine that's probably at that point of time, at least, not keeping up with technology. Most of the technology has emerged in some parts of the United States or Europe or even Japan. But why Middle East? What was that specific need there?
I was actually working on Wall Street at the time, and kind of got tired of Wall Street and wanted to make a career change. And an opportunity came up with an American company to be sent from New York to the Middle East to work in the Gulf region predominantly to deploy healthcare. What today we call it a health information network. Back then it was a telehealth network, and it linked major medical centers from like Harvard and Yale and Columbia to teaching hospitals in the Middle East that then could do everything from grand rounds to remote surgery assistance to secondary patient consults and kind of everything in between. So it really was cutting edge American technology being expanded around the world, and developing the business solutions to go along with that, as well as the partnerships, both in education and in training and in technology. So I got a chance at a young age to explore building international tech partnerships and building educational partnerships, where we had telemedicine solutions from as far afield as Australia and Norway, and then utilizing everything from Swedish radios to Canadian robotics and kind of everything in between. So it was nice cutting edge, and it was an opportunity to explore healthcare and understand, it all begins with that patient experience, and how do you can put all the tech in the world you want to in play, but if you don't focus on how you make that patient experience work, it just doesn't work and make the difference you hope it will. So we were very successful in getting a program that still exists today. We were successful in implementing electronic medical records, high-end solutions from at the time, the Cerners and the Epics of the world, all the way to, kind of back-end Oracle financials. And we just had a blast learning. When I got tired of doing that, I wanted to come back and, kind of do my own thing. I was able to make that turn in 2000 and started a couple of companies and sold a couple of companies. And all along the way, it's all been about, healthcare and how do we help patients have a better experience.
That's incredible. So there have been like 2 pivotal points in your career, and I believe one was from Wall Street to going to Middle East. So that was pretty drastic. And there was second, then coming back from Middle East. If you don't have to answer this question, but I'm curious, was there a personal reason that from Wall Street you just decided to uproot everything that you have built so far and do something dramatically different?
Well, it probably was less different than it sounds. I'd grown up in the South, and I was grew up in the buckle of the Bible Belt, and had been an economics major, and decided I wanted to, instead of having a career in sales, I wanted to go get an MBA. And so I got accepted in Manchester Business School in the UK, not too far from my homesake or my namesake town, Oldham, in the north of England. And got my MBA there, studied there, worked in the city of London, then went to New York. And when I was in New York, I wanted to go back and have an international career. So I looked around when I got ready to make a change. And, a couple of things were important. One is I wanted an industry where I could make an impact. I could do something really that I would be proud of doing. And that was a huge change for me. You're right. The second change was to come back and to decide to be more entrepreneurial. And, I got an opportunity to buy a company that I was employee number 6. And the original founders got ready to retire. And they said, we're going to sell this. And I was like, well, let me see if I can put some money together and buy it. Bought a company that had about 30 employees. We grew it up to about 400 employees. It was in health IT. Did a lot of work with the U.S. federal sector and some work internationally. And just had a terrific opportunity to innovate and grow and build some really cool projects that made a difference in the federal sector. Sold that and then started Accela about a year or two later. But those were the pivot points. You're right. To leave New York and then to come back and decide to be entrepreneurial in my own right.
That's awesome. So, considering your experience, where you have really set up, implemented systems large scale, and the entrepreneurial experience itself, one critical part is all that information, all that experience that you had initially implementing with technology that was probably not anywhere close to what we have now. And still, do you see the parallels of the same issues in the United States right now in the rural areas? Is there something that you carry on that type of experience and the entrepreneurial spread to solve issues that are currently present here in the United States?
Well, I think, there were a few kind of good things that came out of COVID with respect to technology and healthcare, right? And quite frankly, the legal framework around the delivery of technology in healthcare. And, telemedicine could be as simple as somebody picking up a phone or sending an email. It doesn't have to be, a high tech, video interchange like we're doing now. It could be a number of different, possible avenues of delivering the care or coordinating the care or sharing information with caretakers. And there's a lot of different ways you can use technology. I think the issues in rural healthcare in the US where the access to care, it doesn't even have to be rural. Access to care is often just as much an issue in an urban setting. It's just a different form of the problem. That often is more poverty than geography, right? But nonetheless, I think the opportunities to extend limited healthcare resources using technical means is much more broadly accepted, I think, now post-COVID, and the legal framework is still fairly open to allow that to happen. I think the challenges that you face in that are less limited by technology anymore and more limited by user acceptance on kind of both ends of that, the clinician and the patient. And so if you can get across those boundaries, and it requires healthcare organizations like what we're doing at AscellaHealth, quite frankly, to be smarter. The days when you could rely on a fax machine or a phone are gone, right? We need to be able to send a text and transfer information and get test results to my cell phone and all of those things. And at the same time, make sure that script gets to the pharmacy and gets filled, right? So I think there's a lot more that's possible, but healthcare organizations have to be nimble and accept that and actually deliver on that promise.
Thank you very much for that. I'm tempted to ask this question, but it'll be very hard to predict. How long are we going to use fax still in some systems? I will not ask that question. It might be a bit contentious.
You'd be surprised. I cringe when people want that, and they want it sometimes for interesting reasons. I think they want it as much for information control sometimes as service, right? And I think the service suffers anytime you force your patient population into just kind of one communications medium. I mean, if you had to tell me I got to sit by the phone and wait for you to call to schedule my appointment, and I have some providers that are that way, I tend to not want to go back to them, right? Because I'd rather be able to go online, set up my appointment, just like I can make a restaurant reservation, or I can make a reservation in an app for a travel experience, right? Whatever it may be. So I think technology needs to be both embraced and then put the business rules around it that protect information, protect the user experience.
The thing that I'm hearing is basically fax may be available as an option for longer time, but we have to bring in more channels. And sometimes some systems operate primarily on fax, and that has to change and bring
Has
more
to change.
channels. And this is coming from not the perspective of a system, but perspective of the patient, because patients would prefer to have those channels available to them. Thank you.
Yeah,
Thank you for
yeah,
that insight. I was like, let's get rid of fax, but some patients might need that system at some point.
some patients might, and some providers might, and I think it's omni-channel is the right way to think about it. But to the extent that you can modernize, it's better. Just a short personal experience. My wife had a provider a couple of weeks ago where they wanted it by fax, and she was texting me going, "Can we fax from home?" I have no idea. Where do I go to? Like I say, you got to go to the UPS store. The same people that do the notary, they'll take care of it for you, which is horrendously inconvenient. That's just is what it is. So I think people will gradually get there. It's down to that patient experience and making sure we get it right and make it as painless as we can.
Thank you. A little bit more of your insight on AscellaHealth itself. AscellaHealth stands out as a leader in specialty pharmacy solutions with groundbreaking technology. Can you summarize its services and unique approach to improving lives of patients with chronic conditions or rare diseases?
So AscellaHealth started as a business helping payers manage their more chronic and hard to treat patients, right? So the idea was we help patients get their medicines cost effectively, quickly, in the venue that they want them. So we manage everything from if you've got an infused drug and you don't want it in the hospital, we can help you get it delivered at home if that's possible. So we're all about trying to help payers get their patients taken care of in the most cost-effective way with the best possible outcomes, right? And so there's a lot of, and this is not your $5 pill, right? These are extremely expensive medications that require a lot of coordination and a lot of work between the payer, the provider, and that patient and their families. We're trying to streamline that process and make it as quick and as painless as we possibly can. On the other side of our business, we also support actual pharma companies with specialty products that are dealing with rare and orphan patient populations. So they would think of diseases with less than 100,000 patients in the US, that kind of a patient population. They need a very similar care and handling, right? So we provide with our own pharmacy, we make sure those products get to the patient. We make sure that we handle their relationships with their insurance providers as well. So we can actually make sure that the drug is covered. If they need patient assistance programs, if they need, any kind of program to help them get taken care of, ranging from behavioral health in some instances to free drug programs work to dietitian services in some cases. It's a wide range of both clinical and logistical services to make sure those drug manufacturers, their patients are taken care of. So it's an interesting program. I think that works extremely well for rare and orphan diseases. It also works, I think, for more provider-centric models where the provider is handling a larger patient population, but they still need the care and handling that we can do. We have a broad range of services, both clinical and technical, but those services are all about helping patients get their medications as quickly and as cost effectively as we can.
May I double click on this idea? It looks like you have end to end with patients in mind. How can we best help them get access to the drug and get delivered to them? So you did talk about infused, then you said, and also drugs being delivered to the homes. It looks like you do work both on the prescription side of prescription benefits and the medical benefits.
Yeah,
What do you mean by
exactly.
care and handling? What comes primarily to your mind when you talk about prescription and care and handling when it comes down to the medical? Can we split that a little bit and help me
Sure.
understand?
So if you take the classic case, and I think it's something like 60% of specialty medications in the last 2 or 3 years are coming out infusion based, right? So it's you've either got to get your drug in the hospital or in an ambulatory infusion center, it's the AIC market, or delivered to your home. So we will manage for pharmaceutical manufacturers, we'll manage where that happens. We'll manage making sure the nurses are there if it has to be a mediated product, if it can be self-administered, which is rare, then that's one thing. Or we'll manage the site of care to get the patient to that hospital or doctor's office or ambulatory infusion center. So it's all about making that convenient for the patient at the lowest possible cost, right? So that's what we'll do. So that's one, I would say, major type of solution set that we offer. Similarly, but with a slightly different business model, is we have a growing number of cell and gene therapy clients, where those are typically delivered in what's called a clinical center of excellence. So that might be an academic medical center, one of the major medical centers that we have in the country. And so then it's about making sure the patient has the procedure that they might need to be able to access that cell and gene therapy. So in some cases, it's a biopsy. In some cases, it's other clinical interventions. And then coordinating that care where we're not necessarily even dispensing product, but we're making sure that the patient gets to the product, and then the treatment follow-up is done, and any follow-up medications that they might need are also done, and then we're handling the payer relationship of managing that process as well. So those are kind of the ends of the continuum, if you will. We have a few oral therapies where it's actually much simpler. It's almost a mail order model where we're still doing all the patient care services, we're still doing all the insurance-based services, but the product comes to the patient's home and they can administer it themselves. So those are kind of the three main models of making it easy for patients to be cared for.
So if I were a patient, if I'm getting help from AscellaHealth, I'm making a lot fewer calls. I'm more aware of what kind of patient assistance services available. So I'm just more informed and a lot less effort, and I'm getting the best care possible. For AscellaHealth, how do you get paid? Like, who's your client?
So we get paid in two primary ways. The payer side of our business, which is, we work on behalf of insurance companies to make sure their patients are cared for and kept on therapy. That is probably about, 60% of our business, I would say now. The other 40% is the actual drug manufacturer pays for us to support their patient population. So they pay. And we are, the model we have is one where the pharma company works with us exclusively. So with that, they get a much more bespoke kind of custom concierge care for their patients, and their patients build a rapport with our teams at our pharmacy where they know who they're going to get when they call in, right? And they're actually cared for, and their caretaker can call in. We've had kind of the heartfelt experiences where that rapport and patient has been cared for over time, and our staff ends up being invited to major life events like weddings and anniversaries and things, which we love. We love to hear that. We love to hear the patient stories that they were cared for, because we're not talking about people that have a minor healthcare challenge. We're talking about people with life altering conditions that are going to have them for the rest of their life, and so they need these medications, and they need to know that they're supported, and their families need to know they're supported. So we feel very good about the fact that we do that. We feel very good about the clients that want to be served in that way, the pharma manufacturers that want to do the right thing by their patients. That's not always the case. I mean, there are those that are chasing the almighty dollar, and sometimes we need to say, look, that's not who we are. We're about making sure that patient is cared for, and occasionally we find that it's not the right fit. And we have to unfortunately say to those manufacturers, we respectfully suggest you seek other partnerships. And it's a shame, but that's kind of the nature of the world we live in. We are, we're here to make a difference. There's lots of other ways we could be making a living, but this is really about doing good while we still have the opportunity to work and be on this earth. So that's what we're about.
Doing well while doing good is something I have really begun to appreciate. Effectively, the patients do not have to spend anything extra, but they get a lot of benefit out of AscellaHealth, and the manufacturers and payers are taking care of this. And what also it means, and especially for chronic conditions, it's not just the patients, it's the family, the caregivers who are also impacted. You did mention on a generic level that these things happen. Is there a specific story you can share with us that really is close to your heart, where the patients came back and said, without AscellaHealth, my life would have been different?
Yeah, I think we actually were blessed to have a patient come in with one of our clients to our pharmacy, last summer and share their patient story. It really was heartbreaking, the journey that they had been on prior to getting on this particular therapy. I mean, it had been years of going around to different specialists and saying, well, you're being told, this was wrong or that was wrong, not really finding the therapy that worked. And, when they found someone who was able to send them to the product that we take care of, their life and their ability to do things in their life changed so dramatically. And it was really terrific for, our teams to hear, because a lot of times, that patient, that family is on the other end of the phone, and you don't necessarily hear, what the impact you're having is. You're dealing with, did FedEx get it there, or what's my copay, or those kinds of things. And just to connect at that human level was huge. I'll tell you a personal story for myself. I mean, one of the reasons I decided to invest in this business was I have two kids that are medically complex, that have enormous challenges on a daily basis. And I married an immigrant from Canada. She didn't understand our insurance system, and so when the kids got sick, it was a company like Accella, it's now part of one of our partners, that actually spent the time to explain to her how to get the kids the medications that they needed, how to deal with insurance. And so I looked at that and said, that's a great business if we can tech enable that, if we can make it a better experience all around. That's a business I want to be a part of. And so that's the kind of the heart and soul and passion that we've taken into building Accella over the last dozen years or so. And it's been an incredible journey. We've got a lot of great people that do the same kinds of things that, quite frankly, helped my family. And we feel really good about that.
Thank you very much for sharing that story. And one more question about AscellaHealth. What are the recent business wins that you had with AscellaHealth? Anything you want to share with us?
The recent wins?
Yeah.
I think what we're excited about recently, we've had a number of our products, I think, begin to change the clinical standard of care. And that has been great to see. They're getting more patients, they're growing. Probably the most exciting thing we've seen recently is a lot of cell and gene therapies actually coming to market and getting approved. And so we're getting ready to launch two new ones that are, in the planning stages now. We're building the teams for those manufacturers, and we're growing that business. I think the other thing that we're really excited to see is the uptake on our site of care management program. That predominantly impacts our payer side business, but those clients, it's all about making sure that patient experience is as convenient as possible in the lowest cost setting. So we're clearing out backlogs in hospitals and getting that delivered at home or at ambulatory infusion centers or doctor's offices or wherever it may be. And the cost benefits of that are extraordinary, but the convenience benefits of that are even more important. So it's exciting to see the uptake in a lot of these areas. The business just continues to grow. With that growth comes, all the challenges of that, but it's been a terrific couple of years to watch this grow, in the post-COVID world.
That's awesome. And you said that you're really excited about gene therapy. And effectively, there are gene therapies which can actually not end up treating the patients and make it non-chronic effectively. And I think it's phenomenal. And when you said exciting about gene therapy, what was the factor that excited you the most?
Well, I think there's a number of the cell and gene therapies that are out there are, well, I think we'd like to believe that a lot of them are going to end up being curative. I think there's going to be a subset that are, but I think there's going to be probably even more where it's just a dramatic improvement in the quality of life. And the struggle we've got in the U.S. context, and in our European business we see this as well, but the challenge is, nowadays we're not dealing with healthcare costs only at the end of life. That's still there, but we're dealing with people living sicker longer, and they're more medically complex. And so if you can get cell and gene therapies, which we're excited about some of the products that we're helping with, it doesn't have to be curative. If it can reduce the medical complexity and make sure that people have a greater quality of life, they can be productive in society, the burden on their families is less, all of those things are worth doing, right? And so that, to me, we're excited about what it does to change the possible trajectory of some patient's life that didn't have an option before, right? And I think that's where it gets exciting for us. Is we can really look at it and say we did something good.
That's awesome. One last Astella Health focused question for you. You did talk about quality of life, and I think there is a direct impact on quality of life with testimonials when people are involved with Astella Health, with patients get the services of Astella Health. My question is there a metric you have where the outcomes, the clinical outcomes have improved because of patients who are involved with your help compared to patients who are not?
Absolutely. I mean, typically it's going to vary what that measurement is by the condition. But there are regular touch points with every kind of patient population that we have to measure how they're doing against a whole host of both life indicators. It could be mobility, it could be energy levels, it could be discrete kind of vitals, things that are under control, right? I mean, I think it's kind of all of the above depending on the condition that we're dealing with, because we have everything from oncology-based products through blood disorder products and to diabetic kinds of treatments as well. So there's a wide range of those, and each one is different. I think the common themes are around ability to be active, and whether that's flexibility, whether that's mobility, or whether that's general energy levels. I mean, there's a number of different things that you can measure there, which are kind of far from my expertise level. But there's also, I think, general kind of before and after I was able to do, and now I'm able to do more. And that's kind of what we're looking for and hoping for with all of the folks that we serve.
Thank you very much. Maybe there's one more question related to Astella Health. You're having an enormous impact, and growth is healthy. With those comes challenges, as you alluded to. What are the challenges that you're facing, primary challenges?
And I think the challenges we face are not necessarily unique to us and our vision. I think they're where we are in the market. We always need good people, so we're always looking to try to recruit. So I think the challenge there is to continue to redesign our workforce so that when we face challenges in finding people, we can still support our clients and we can still support our patient populations. There's always a challenge in finding the right folks, and that continues to be an entrepreneurial challenge. I think there's the challenge often in technology is making sure the technology really supports the mission effectively. And I think we have to always orient our tech teams, and we have some fantastic people in that area that are helping us really make a difference in terms of being able to create a much better patient experience as a result of our technology. What we're working on that I think is a challenge now is working on making sure we can streamline a lot of the back office between ourselves and our payer partners. And so those are the challenges that really require us to use technology better. I think that isn't necessarily AI, machine learning, or any of the, kind of the things that capture the headlines, but it's more just doing the blocking and tackling well. And I think that's the business challenge. I think is pretty much always focus, do the right things, and make sure that you keep the mission kind of first and foremost in your mind. If you do all that, good things tend to happen.
Thank you very much. That kind of brings us to our next section where we are seeing advent of there's a shift in technology, and everybody talks about it. Where do you think we are going as a healthcare system from your perspective? Where do you think we are going to be in the 1 year, 2 years, or even 5 years. And the important question here is, where are we going? Where do you think we should actually go? And where do you think, how can we impact the development of technology so that we actually end up somewhere which is more optimal than, say, less optimal?
So I think there's two primary areas that always kind of concern me when I look at technology and healthcare. I'm old, so I've been doing this a little while, and I've seen these curves go back and forth, right? Of what's the hype cycle, right, as Gardner calls it. And I think the two major areas are, for years we have spent very inefficiently on the back office of healthcare, right? The benefits piece of it, the insurance piece of it, the payer piece of it. I've seen numerous studies, as I'm sure you have, somewhere around 30 to 40% of labor in any given medical system is just dealing with the payment cycle, right? Just dealing with insurance, dealing with the residuals out of insurance, dealing with copay. I mean, it was I saw one system down south that had 10,000 employees, 4,000 of which were in those functions around revenue cycle management. Essentially fixing that and automating more of that, and I think putting technology to work to enable payers to help manage that more effectively with provider organizations, I think is a huge area for both efficiency and for savings in the marketplace. I think the other area that I'm perhaps more aligned with, because Accella is already there on that back end automation. Some things we can do better, but for sure, I mean, we're headed down that path of being streamlined. The other part of it that I see is really what I call the better data for better care conundrum, right? Is how do we get better information for the things where we don't necessarily know what good looks like in healthcare? And you have a disconnect between what a patient and their families know to tell a provider and what the provider wants to bring to the encounter themselves. So I'm spending a lot of time and energy in my nonprofit world looking at how do you help chronic disease communities use data better, whether that's a patient registry or whether it's a gateway to medical research or whether it is a portal for patients to report their own outcomes. I think all of those different kinds of approaches, depending on the patient community, can really help all the other stakeholders. They can help pharma, they can help the public sector, they can help the payer community, but really you have to enable that patient community, generally in the form of an advocacy organization that is better at advocacy than they are at data. And so that's kind of my nonprofit role, is I seek to help those kinds of communities really bring data to that care interaction and say, look, let's advance what that science is and what it's capable of doing, and let's level that playing field between the family who may not know and the provider who may not understand everything that's being said to them, right? Let's make sure that we can actually have an interaction there that's meaningful and get these people the right care that they need. And from my personal experience, that's a battle my wife has fought for over a decade now. And sometimes it's not pretty, but you have to keep at it and help these communities get better information. We've done that in autism, we've done it in limb loss, we've done it in macular degeneration, and those are exciting fields that impact a lot of people.
These two issues that you spoke about is an as attestations where your mind is. One is about the clinicians and the care providers, and the other one is the patients. I really appreciate that. Yeah, I'm thinking about all the impact that you're thinking about, and future is hopefully really, really good for all of us. You started your statement saying that I am old, I have seen all this keep changing. I think you meant I'm wise because I have seen all these things, and this is exactly what we need now. We need a lot of wisdom because a lot of things are popping up all over the place, and the utility of these ideas and the brilliant ideas can be implemented a lot better with this type of wisdom. So, what would be your advice to the new leaders who are coming up in this field or the entrepreneurs who are coming up in this field? What do you think is a non negotiable mindset that they need to bring to the industry to make sure that next 2 years to 5 years delivers on its promise?
I think the main thing is to keep the focus on what is that end user experience? What is that difference you're trying to make? I think there's a kind of a visual trickery, if you will, that comes with the technology where people get enamored of the bright shiny toy and they forget that we're trying to solve a problem, hopefully at a human level for somebody, and really make a difference. And I think that's if you keep your eyes on what that difference is you're trying to do, then you can gear the technology in the right direction. There's so much that we don't know. And I think that's the other thing is acceptance of ignorance does not mean you want to accept the status quo. Acceptance of ignorance means you need to understand what the next question you want to ask is to expunge that ignorance. And there's a value in admitting you don't know something so you can get to the answer. And I think that's something that when we get all wrapped up in the tech, we seem to forget sometimes, what's the question we're trying to answer and what's the impact we're trying to make.
Thank you very much. As we come to close to this incredible episode, you have 90 seconds. If you want to take 4 minutes, that's okay too. If I have missed some questions or if you want to reiterate something you think is really important that we might have missed during our recording so far, the question is yours, the answer is yours, and the stage is yours.
Well, wonderful. And thank you for the experience to be here. It's been a great time to chat with you. And hopefully there's been something people can take away that's of value. I mean, I think from my perspective, when you think about healthcare and you think about technology, really the question becomes is why? Why do you want to do it? Why do you want to be in this field? There's lots of different ways you can make money. I tell our drug manufacturer clients this all the time. It's like we didn't choose to do this and be in specialty pharmacy because it was a pathway to riches. We chose to do it because it was a pathway to impact. And so I think if you end up, not asking yourself that why question, I think generally speaking, you're going to regret it. And then I think the corollary to that is when I know what that impact is, I need to be very clear-headed about what kind of technology can make a difference and where. And it's not tech for the sake of tech, because I've seen a lot of people buy it and leave it on the shelf and it just doesn't make an impact. And it's a shame because there's a lot of impact that can be made. And I think it's eyes wide open. Well, let's figure out how to make a difference. And that's all there is to it. But I appreciate the opportunity to speak with you.
And I truly appreciate the time and all the wisdom. And thank you very much.